Have you ever worried about having an unexpected car delivery on the way to your birth location? Well, today I'm going to tell you how to prepare so you know exactly what to do. But before I begin, my name is Midwife Kyra and I believe in truly natural birth because I know that it makes for better birth experiences. Consider subscribing to my channel and feel free to leave any questions or comments in the comments below. So this is my little friend and he's going to be helping me talk to you about what to do if you accidentally deliver your baby in the car. So have you watched those YouTube videos where moms are accidentally delivering their baby unexpectedly in the car, and first thing that they do is they deliver their babies and they hold them out like this and they just stare at them in disbelief, right? They're shocked. The one thing I see in common in most of these videos is that the parents were unprepared for this to be a possibility. So the first thing you need to do, no matter where you're giving birth, if you're not having a home birth, you need to have an emergency bag packed in your car, and it should have towels, and maybe even a bulb syringe if that's something you want to have on hand, but definitely towels. And why? Well, because when babies are born, they're wet and they're cold. And the first thing we need to do is be drying our babies to dry them off, not staring at them, right? Well, what happens if you didn't pack the bag in time? The driver of the car, which is usually dad, can easily take off his shirt and dry the baby. And to keep baby warm, moms, all you have to do is tuck baby up underneath your shirt, skin to skin. Babies just need the warmth of your skin. You're plenty warm enough to keep them warm. At this time, usually 911 is called or you pulled over to the side of the road. And if you're on the phone with them or if the ambulance shows up, they're going to ask you to cut the umbilical cord. I need you to know that you do not need to mess with the umbilical cord if you're having an unplanned car birth. The best thing to do is leave it alone until you get to the birth location and let them separate the baby from the placenta in their location with sterile instruments. This is not something you need to be worrying about. The baby staying on the cord is not a problem. What is most important, like I just said, is drying the baby and keeping the baby warm by the warmth of your breast to your skin. Not over your shirt, but actually under your shirt, right? We're gonna keep our baby warm. So what happens if the baby's born and the cord is wrapped around the neck? This is such a common question that I get asked about. Well, first of all, you can rest easy knowing that 1/3 of babies are born with the cord around the neck, and it's usually not complicating delivery in any way. If it's possible for you to remove the cord by pulling it over the baby's head while the baby's being born, you can. But if you pull on it and it's too tight, don't worry about it. Just let the baby be born. After the baby's born, you'll lift the baby up and you'll unwrap the umbilical cord from around the baby's neck. No problem, guys, it's okay. The other question I often get asked is, what happens if the baby's not breathing when the baby's born? So just very, very basic infant resuscitation for you. When you're giving a baby a rescue breath, which sometimes can happen when babies are born very quickly. Sometimes they're kind of shocked and they don't know that they're here. Sometimes they come out screaming, but sometimes their eyes are open, but they haven't inhaled, right? So we need to give them a rescue breath. When we're giving a baby a rescue breath, we're gonna put our mouth over baby's mouth and nose, right here. So you're gonna put your mouth right here. And you just give baby a really gentle blow. Usually 1 or 2 of those and your baby is going to fight you off. Babies do not like when you're breathing in their lungs. But usually a puff or 2 will perk a baby up, it inflates their lungs and reminds them to breathe. Now keep in mind now, if baby's still connected through the umbilical cord, they're experiencing what we call delayed cord clamping. They're still receiving oxygen through the placenta. You're gonna know the difference between a baby who needs just a simple rescue breath versus babies who are vibrant and vigorous and crying. You're gonna be able to tell the difference. Babies who need a little rescue breath, oftentimes their eyes are open, not always, but sometimes, and they're just kind of stunned because the adrenaline is running through them too. And so that little rescue breath can bring them around. Oftentimes, they're kind of limp. They need a little bit of extra support. So, and poof, baby's gonna perk right up and scream. And that time, you're gonna tuck the baby up underneath your shirt to keep them warm, just like we just talked about. Okay, so what kind of questions do you have about delivering your baby in the car? Unexpectedly, of course, because nobody would want to plan that intentionally. And have you prepared your your car for a possible car birth on the way to your birth location? Let us know in the comments below. Otherwise, I'll be seeing you at one of my other Midwife Monday videos over here. Thanks for watching. Bye-bye.